A very good afternoon and welcome back into the room. Can I ask that we make our way to our seats and settle down? Our next panel is about to begin. We are nearly at the end of the conference and we've put together such an incredible panel with so many interesting voices. I'm really looking forward to moderating that. Now, we've already seen how easily pandemics and outbreaks can destroy years of progress in routine immunization. Now it's time to assess that single greatest health threat facing humanity, which is climate change. What do we know already? Well, the latest Lancet Commission analysis says that climate change has already produced considerable shifts in the underlying social and environmental determinants of health at a global level that threaten to reverse the trend of falling global burden of infectious disease transmission. According to the World Health Organization Director General, the climate crisis is a health crisis. This session is going to look at the impact of climate change on infectious diseases. The session will be divided into two halves. First, we'll hear about the health challenges that countries are facing due to the impact of climate change. We'll hear from Niger and Uganda on how the impact of climate change is being felt on the African continent or parts of the African continent. Then we'll turn to the Africa CDC, a donor and a financing partner, to hear about the importance of immunization in preparing for the worst effects of climate change and how both are working on this with Gavi. Next, we'll shift to solutions. We'll hear from a selection of Gavi's partners working on practical solutions to these challenges. Financing institutions, civil society and the private sector will speak about their work with Gavi in helping countries prepare for climate change and the next pandemic. For that, I'm joined by the following: Her Excellency Dr. Jane Aseng, who's the Minister of Health in Uganda; Dr. Ibrahim Suli; Dr. Ibrahim Suli, the Secretary General in the Ministry of Health in Niger; Dr. Jean Kasseya, who's the Director General of the Africa CDC; Dr. Tanya Rodia Forvek, who's the Director General of Global Health, Resilience, Equality of Opportunity at BMZ Germany; and Mr. Michael Anderson, the CEO of MedAccess. That's not all, though. We've got lots of contributors to the session. On the front row, we have a world-class lineup of leaders and experts, each with a unique perspective on the solutions that will be needed to face up to these challenges. Let me introduce them to you now. I'm proud to introduce Mr. Marcus Berndt, who's the Acting Managing Director of EIB Global, the European Investment Bank; Ms. Joanne Carter, who's the Executive Director of Results; Mr. Farid Fazua, who is the Global Director, Health and Education of the International Finance Corporation at the World Bank Group; Ms. Farah Lopsa, who is the Chief Commercial Officer at BioVac; Mr. Saul Walker, who is the Director of Public Partnerships at CEPI; and Mr. Wang Guangsheng, who is the Vice General Manager at Higher Biomedical. Thank you. We are also going to ask Dr. Seth Berkley to come up and make some closing remarks at the end of the session. Thank you all so much for your time. Dr. Aseng, perhaps I'll start with you. Can you tell us, Acheng, thank you so much. Can you tell us how Uganda is experiencing the challenges from climate change and how the health sector can help countries to adapt to climate change, and how, give us examples of how you're preventing, preparing, and responding to any future pandemics.
Thank you very much. Allow me, first of all, to thank Gavi for this opportunity to talk about climate change and what it is doing to Uganda and its relationship with vaccination. We are all aware that the relationship between climate change and the prevalence of severity of infections has become more evident in the last 15 years. And Uganda, just like other countries over the past years, has experienced frequent environmental disasters that range from droughts, floods, landslides, earthquakes, lightning, hailstones, windstorms, and fires, amongst others. These disasters, most of which are climate-induced, are becoming frequent, increasing in complexity, and consequently affecting more people, livelihoods, and socio-economic systems more than ever before. And in particular, climate change is causing negative impacts on our economy and many other economies, on communities, and health services, which are more often ill-prepared to respond to these threats. And I can give examples when we have floods and hospitals are washed away, and patients have to be relocated to other places because of that. We have had this happen a lot in Western Uganda, which is a very beautiful, hilly place. Once we get floods, it is very catastrophic. The threats to humans caused by climate change are threats that brings pathogens closer in proximity to humans and displaces human populations, in turn bringing people into closer contact with pathogens. But we are aware that vaccines play a key role in addressing complex health challenges induced by climate crisis. And I will talk a little bit about some of these. First, if we look at the delivery of healthcare alone, and the futuristic person earlier on spoke about the carbon dioxide emissions that come from providing health services to people. But we also know that when we provide vaccines, for example, the flu vaccines, then we get fewer people going to the health facilities, and therefore less use of the hospital systems and equipments, and that, of course, in turn will decrease the carbon dioxide emissions that are associated with handling patients. But also to note, especially on the issues of vaccines alone. Uganda has had a number of cholera outbreaks, and Uganda launched in 2018 the cholera vaccine for management of the cholera outbreaks. It has been very instrumental in the control of outbreaks. And throughout this climate crisis, the floods, the landslides, and so on, we've not had any cholera outbreak. And you can imagine how much that has gone into protecting people, but also reducing on carbon emissions and saving lives. Another example that we have just been discussing a few minutes ago is the malaria vaccine for children. Uganda plans to have this introduced in 2024, and we also believe it will go a long way to help curb the frequent malaria epidemics that the country is currently experiencing due to climate change. We have had over 70 districts out of the 146 reporting malaria epidemics. We have managed to bring this down, but we are still worried as the processes continue. Uganda has also been prone to sporadic yellow fever outbreaks since 1942. This year alone, cases were reported in 3 districts. And therefore, as temperatures grow warmer, the worry is that more outbreaks are bound to occur. But again, we are grateful to Gavi. Uganda introduced the yellow fever vaccine into the routine immunization, and therefore more and more people will be saved. Therefore, we cannot address climate change without thinking about vaccines and the impact that it has on the health of the populations.
Thank you very much, Dr. Acheng. Dr. Suli, let's pick up on how Dr. Acheng has spoken about the impact of climate change. I'm just checking that the French translation is working and you can hear. No. Okay, perhaps we'll sort that out, and while we're sorting that out, we'll come to Dr. Tanya. What can donors do to support countries in preparing for this next pandemic, whatever it is, and ensure that there is an equitable response to it?
We have a video.
You've got a video that's going to play.
Dear participants, the Gavi partnership has made it possible
to provide an entire generation with vital vaccines. Since its inception, 23 years ago, Gavi has prevented 17 million deaths, and that is unprecedented in history. Gavi has done a great job, including in particular during the COVID-19 pandemic. The Alliance coordinated the COVAX vaccine platform, distributed nearly 2 billion doses of vaccine. This has saved many lives. Unfortunately, the pandemic reinforced inequalities worldwide. This includes access to vaccines. For example, there are still 80 million children with no immunization at all. As an international community, we urgently need to change that. It is unacceptable that children still suffer from avoidable diseases, that they die from them or are left with lifelong disabilities. Universal access to vaccines and basic immunization are absolutely vital for the fight against infectious diseases. Immunizing children protects entire societies. Vaccination helps to strengthen health systems, and it is also essential for global health security because diseases do not stop at borders. That is why it is so important to make sure that all people have access to vaccines and the health care, no matter where they live. Gavi and Germany are therefore working for improved regional vaccine production. For instance, we are helping the African Union to expand production in Africa, thus putting regional supplies on a reliable basis. The development, production, and distribution of vaccines will remain important. For effective pandemic prevention, it is vital to reach and protect vulnerable groups in particular. They include women and girls, people in rural areas, and displaced persons. After all, immunity is only possible if everyone is immunized. Germany continues to put its faith in Gavi. The partnership model has shown that together we are strong. So let us jointly continue this successful model for generation immunity.
All right, it's good to get that intervention.
Yeah, thank you so much for the question. So we brought this video to really showcase that Germany is very much committed to Gavi, and that this alliance is something we would like to support many years further on. The minister has to be today in Berlin for another event and just came back from the G20, so otherwise she would have been here. So before I answer your question, I'd like to emphasize one point she made by and in the video message, and this is vaccines are crucial for effective pandemic prevention, and with this the integration of immunization is a cornerstone in our work against climate change and to pandemic preparedness. So this is combined. To answer your question on the role of donors, this is what you asked me, I would like to focus on three aspects. First, we need to create and strengthen the intersection between the climate and health and break down these kind of silos. I think there's not that much interaction yet. Secondly, we would like to support the resilient and sustainable and equitable health system. And the third is finally take the multi-sectoral, holistic and inclusive action and focusing on the regional manufacturing capacities in Africa. So let me come to the first point, intersection of climate and health. Climate change and the pandemic preparedness, prevention and response is quite complex. We just heard some effects, events, what happens in the countries. But this intersection is still largely overlooked, and we need to take a more holistic view on this. When we look into the numbers, currently only 2.5% of global climate financing is going to health. And this is very, very little. And I think it's important to concentrate that we link the action within the climate work stream with the health issues. And this much more systematically and much more sustainably. And with this, I'm really happy that the momentum is there to address this, because Germany is part of the Alliance on Transformative Action on Climate and Health, attached. We heard about this morning. And this is an outcome of COP26. It was also recently announced that on COP28, there will be the first COP with an entire day dedicated to climate and health. And this provides an important opportunity for us to interact with the climate communities and negotiators. And of course, with this, we welcome very much that Gavi's increased efforts to address this nexus. The multilateral organizations play a crucial role in the further path that has to be gone to this intersectional cooperation. My second point, supporting resilient and sustainable, equitable health systems. Health systems are a crucial factor for effectively and efficiently preparing for preventing and responding to the pandemics, and at the same time for adaptation to climate change. So only a resilient health system can commute with these kind of disasters. And my third point, multilateral, holistic and inclusive action. So climate change and pandemic preparedness are complex and demand a multilateral and multi-sectoral approach. Government, business, academia, civil society and individuals must work together to implement within their own range sustainable practices and reduce emissions. So we have a shared responsibility. And this means, for example, investing into sustainable zero health systems and also convert green spaces to get better air in cities. So with this, I'm glad to announce that Germany government go ahead and make concrete commitments. Germany has signed an agreement and framework that take a clear stance in favor of a just climate transition. And we have also committed 2 billion euros for the Green Climate Fund, and this is in a way earmarked also to activities linked to global health. Thank you.
Thank you very much. Dr. Silly, c'est bon? C'est bon. How are you seeing the impact of climate change and on diseases and outbreaks, and how is that immunization program in Niger taking this into account in program design and implementation?
Merci de l'occasion que vous me donnez pour parler un peu de la situation du changement climatique et de son impact sur la santé dans un contexte encore beaucoup plus large, n'est-ce pas, d'autres déterminants qui touchent la santé. Permettez-moi que je me présente un tout petit peu sur mon pays, le Niger. C'est un pays qui a 1 260 000 km². Faites le calcul, n'est-ce pas, par rapport à d'autres pays en dehors de ceux qui sont de l'Afrique du centre, c'est beaucoup. Et ce pays est à 52% désertique. Son climat est caractérisé par son aridité, mais également une pluviométrie qui est très faible, mais également très variable. En fonction de la pluviométrie, nous distinguons pratiquement 3 zones. La zone sahélienne qui reçoit moins de 150 mm de pluie. Lorsqu'il pleut au Niger, la radio nationale informe la nation qu'il a plu à différents endroits. On aurait dû intégrer ça également pour d'autres questions, comme j'ai dit ce matin, pour la lutte contre la médiatisation à autant pour la lutte contre le cancer du col. Il y a une autre zone qui s'appelle la zone sahélo-saharienne qui reçoit entre 150 à 200 mm de pluie. Et la troisième qui est la zone saharienne qui reçoit entre 300 à 600 mm. Et enfin la zone soudanienne qui s'approche un peu du sud, n'est-ce pas, soudanien, entre 600 à 800 mm de mercure. Cette division de notre environnement climatique exerce du stress au sein de la population parce qu'il se chevauche des situations de sécheresse, de fortes températures, mais également lorsqu'il pleut à des endroits où il n'y avait pas l'habitude de pleuvoir, cela crée des inondations. Alors les impacts sur l'environnement, il est multidimensionnel, mais je vais parler dans le cadre de la santé et ensuite les autres déterminants de la santé. Sur la santé, l'impact est direct. Lorsque les températures fortes frappent, n'est-ce pas, surtout le nord du pays, une grande partie, n'est-ce pas, médiane, nous enregistrons des températures de 45 degrés. Il y a ce qu'on appelle les maladies comme le coup de chaleur. Pour les personnes de troisième âge, situation difficile à gérer à cause de la forte déshydratation et bien entendu les décès. Les structures de la santé également à ce niveau n'ont pas les capacités et les moyens qualifiants de prise en charge. Mais également, la sécheresse impacte sur la culture, l'élevage, ce qui fait que la malnutrition est endémique dans notre pays, au Niger. Nous avons le taux de retard de croissance le plus élevé, 46 en 2022, et la malnutrition aiguë globale dépasse l'un de nos ce qui est plus de 12%. Donc, directement, la santé de la femme et la santé de l'enfant prennent un coup, et cela fragilise l'immunité, bien entendu, de l'enfant. Mais nous avons également les autres aspects qui sont des aspects indirects, un peu sur non seulement les parasites, mais également les vecteurs des parasites, mais également l'environnement et le milieu où ces parasites peuvent sévir et attaquer par des intermédiaires l'homme. Au Niger, lorsqu'il y a la forte sécheresse qui prend jusqu'à 8 mois et en forte température, nous enregistrons des cas de rougeole dans pratiquement toute la partie sahélo-soudanienne pendant 4 mois. Mais également, c'est en ce moment-là que l'éclosion, n'est-ce pas, de la méningite également. Nous avons eu des récurrences depuis 2019 avec des sélections, bien entendu, de mi-temps pour laisser le W. Mais nous avons également d'autres maladies qui sont en rapport avec, n'est-ce pas, le climat, qui sont climato-sensibles, comme le paludisme, qui est saisonnier, qui sévit pendant la période, n'est-ce pas, humide de pluie. Contrairement à ce que j'ai entendu avec le Malawi, où lorsqu'un enfant malade de palu, dans l'interprétation que j'ai entendu, c'est la vie qui s'arrête, c'est les autres enfants qui ne vont pas à l'école, c'est la famille. Au Niger, dans le milieu rural, le paludisme est assimilé à la question de l'environnement. C'est lorsque, à un moment, les arbres atteignent une certaine hauteur que le paludisme sévit. Ce n'est pas un problème dans la posture et l'analyse, n'est-ce pas, locale et sociologique, n'est-ce pas, de la population. Donc, il faut attendre qu'ils prennent une partie des enfants, bien entendu, et on s'en va. Mais également, excusez-moi, je vais encore continuer, mais il y a également, malheureusement, la forte inondation qui sévit dans cette région. Et en ce moment-là, les maladies hydriques comme le choléra sévissent de façon endémique dans les régions soudanaises, les régions de Maradi, les régions des Anders, y compris, n'est-ce pas, la fièvre typhoïde. La pluie ne vient jamais sans des fortes de vents violents, avec de la poussière, les irritations des voies respiratoires, avec toutes les maladies comme virales, mais également d'autres irritations, n'est-ce pas, oculaires, qui sont également des indispositions pour la santé de l'individu. Ces 4 types de climat au Niger font du Niger un pays qui a une charge lourde de morbidité en matière de santé, mais également une charge, n'est-ce pas, de financement à grande échelle pour tout ce que le partenariat avec, n'est-ce pas, les bailleurs de fonds et les partenaires. Alors, il y a la deuxième question, pour ceux qui comment s'y prendre, bien entendu, et les mesures d'atténuation. Nous avons au Niger eu à développer 2 générations de politique nationale de santé, 2014 à 2030, et 5 générations de plans sanitaires opérationnels de plans de santé. Dans ces politiques robustes, il faut qu'il comment on appelle ça, le renforcement de santé au nom de l'équité. L'équité et l'égalité que nous prenons pour Gavi, bien entendu, c'est proximiser, rapprocher les soins de santé vers les populations. Lorsque nous ne pouvons pas le faire, bien entendu, sur cette superficie qui est énorme, il va falloir que nous ayons d'autres stratégies à avancer qui sont utiles à la logistique, bien entendu, et profiter de la chaleur et de l'environnement pour la soulèvement de la chaîne de froid.
Thank you.
Merci.
Merci beaucoup. Mr. Anderson, MedAccess is a social investment company. It's backed by the UK government. What do you see some of the biggest challenges to health that are created by climate change? I know some of them have been touched on by members of our panel. And can you tell us how your organization has been working with Gavi on solutions to this?
Thank you, Zika. I'm really moved by the stories of Uganda and Niger and the kinds of challenges that there are. It's very moving. I just wanted to start, though, if I may, I realize time is short, by pausing to reflect on this moment. We are in the presence of a stunning human achievement that Gavi has made over the course of its time. If you would think back to, say, 1955 and say that there could be this kind of mobilization of effort and technical expertise and delivery on the ground, it's really an impressive achievement. And because as human beings, we tend to emphasize things that are going wrong and complain and have a tendency to maybe not recognize what's going well, this is a moment to stand in wonder with jaws hanging open mouth at what Gavi has achieved. It is just terrific and an inspiration for all of us. But of course, the next phase is really different. We've got really big challenges, as we've just been hearing about, and what we do in the future is going to have to be different. MedAccess is proud to be part of that partnership. The key to Gavi is bringing lots of different partners together and mobilizing efforts. MedAccess is a social finance company. We provide loans, working capital, guarantees, partnering with manufacturing firms, but also entities like Gavi, to do three things: bring new medical products into use faster, to reduce the prices of those products, and increase the volume of their production. That's what we exist for. We're a non-profit financing company, and we've had the privilege of partnering with Gavi and, for example, Gavi and GSK on bringing the malaria vaccine to market faster, for example. But turning to climate change and those new challenges, you asked about the challenges. I see four. I'll be very quick. One of them is people are likely to be much more vulnerable. You know, we've just been hearing about changing circumstances, drought, climate change, extreme weather events, displacement, poor nutrition, disrupted housing, a whole range of reasons why people are going to be more vulnerable to disease in the future, and we'll have to respond to that world. Second is we're going to see the spread of infectious disease. We've heard about new vectors, new diseases, broader prevalence, which we've heard about already. Third, there's an increased chance of disrupted supply chains, and that's why it's really important to get some manufacturing in Africa in place so that we have resilience of supply chains and make sure that the channels of distribution are strong. And fourth, this is the one that frightens me the most, I think in the generations ahead, we're going to see a scramble for resources, because we're going to see an increasing number of diseases. We're going to see new innovations and better medical products coming to market, and they're going to cost more, and people will expect to have them. We're also going to see a diversion of resources to climate change, as Tanya has been telling us about. And we're going to see some aging populations. We see some demographic change, which is going to make some of the fiscal positions, especially in high-income countries, more difficult. All of those factors are going to combine to say we're all going to have to get more value for money. We're going to have to get more health care for every single dollar that's mobilized in the future. So how can MedAccess help on climate change and those four things? We can do four things. One is we look to partner with manufacturers to accelerate access to new products as they come to market at lower prices and higher volumes. And that would apply to OCV, chikungunya, dengue, malaria, so on. Second, we're in a position to partner with Gavi and with manufacturers with nimble finance to respond to changes quickly and anticipate. Third, we think there's a big role for Gavi and ourselves in product shifting. Just to give you one example, if we move from pentavalent plus polio, if we move from that regime to hexavalent vaccine, you cut in half the number of vaccine deliveries, you cut in half the number of people involved in moving, and that's really drops the carbon foot really seriously. So we can all pay attention to what are the products we're choosing and how can we choose lower carbon products. And last, I'd like to say that we really stand ready to help support regional manufacturing and the growth of more diversified, localized manufacturing, a really important piece of the future. Thank you.
Thank you. Dr. Kosea, Mr. Anderson just spoke about the manufacturing and the capacity on the African continent. Let's speak about how the COVID-19 pandemic saw the African continent particularly hit hard by that vaccine inequality. And then climate change, on the other hand, is also increasing the threat from pandemics. How is the Africa CDC addressing these challenges? And then can you tell us about your work with Gavi on vaccine manufacturing on the African continent?
Thank you, Zina. Let me first share with colleagues. I think all of us, we know that climate change is seriously impacting and affecting Africa, with millions of lives lost and communities becoming poor and vulnerable. And the way climate change is affecting Africa, we can say we have first these many infectious diseases. I think my colleagues from Uganda, Niger, they talked about it. And if you see cholera now affecting almost 30% of my countries in Africa, and more than 20 million people affected, this is a major issue, and it's related to the climate change. We have the natural disasters, and I think the minister of Niger didn't talk about it. You know, ministre, tu sais, vous savez combien le climat a détruit les infrastructures de santé au Niger. J'ai visité cela. J'ai vu combien ces infrastructures sont affectées. I'm talking about how these natural disasters are destroying health infrastructure. And we know also, learning from COVID, how the immunization coverage is decreasing when we have an outbreak. And this one, combined with the drought, the flood that is creating, that is leading for more malnutrition, more food insecurity. I think the way Africa CDC is taking that, it's more holistic way, how we can really support our countries to come up with what we call the One Health approach. And this One Health approach, I will link that with what we are doing with Gavi. The One Health approach is really to see how we are coming, not only the health sector, but with all other sectors, we are coming together to work together. And we need human resources, well-trained human resources, because when I was medical doctor, I didn't have any lesson on the climate change. Now we need to develop curriculum for medical doctors, for nurses, for them to be well capacitated to address this issue. The health information system, we need a sensitive health information system that can capture also this effect of climate change. We need to talk also about service delivery by using innovation, and we are talking about infrastructures. Then let me talk about financing. That is another one. Financing, we need to have sufficient funding for the One Health approach. With Gavi, as you know, we signed a MOU in May 2023, and we are promoting the routine immunization. We are promoting emergency immunization. We are also promoting local manufacturing. This local manufacturing is targeting also human and animal health. You know, the way we are approaching that, I think Gavi is the game changer for the climate change. Gavi is helping us as Africa to beat the climate change by becoming more innovative, by developing vaccines that can help us to prevent all of that.
Mm-hmm. Thank you very much for being so succinct, Dr. Kaseya. It's now time to get prescriptive. I'd like to invite onto stage Mr. Marcus Bent. He's the Acting Managing Director of EIB Global, the European Investment Bank. He's going to share what steps they're taking to help us prepare for the future.
Thank you very much. Good afternoon. The European Investment Bank has been honored to be a long-term partner of Gavi, and I'm very pleased to take the stage after such an insightful discussion on climate and health. And I would like to thank the Spanish government and Gavi for organizing this excellent conference. There's an evident link between climate change and the dynamics of disease. And we just heard that the WHO has declared climate change is the single biggest health threat facing humanity. As the EU's climate bank, the EIB is committed to moving the needle on climate change. At COP27, we affirmed our unwavering commitment to deploying our full range of financial tools to support the rapid decarbonization of our economies. Acting globally, we will continue to support a just transition to climate neutrality. At the same time, we are very happy to continue to tackle infectious diseases and supporting the deployment of vaccines that are critical to building populations' resilience, pandemic preparedness, and climate adaptation. We must take urgent steps to counter climate-related health threats now. As part of our ongoing commitment, we are excited that we are able to build on the partnership with Gavi that actually began for COVID-19, and that became a core element of Team Europe's response during the pandemic. Together with the European Commission, Team Europe, we were among the first to deploy an innovative financing instrument that allowed COVAX to promptly access financial resources at the onset of the pandemic. In health, as in climate, waiting to act carries a very significant cost for society. Every euro we invest today in health carries a much higher benefit than a euro invested tomorrow. And bringing profitable investment forward is precisely what a bank is for, and that's why we have stepped up significantly and developed, together with Gavi, the financial instruments that allowed us and will allow us to invest in health today, even if the resources will only become available over time. We see these financial instruments as key also to pandemic preparedness, and we're exploring opportunities together with Gavi to cooperate, but also with others in this room, including WHO, UNICEF, CEPI, to ensure that the next pandemic is tackled before it wreaks havoc on developed and fragile economies altogether. I'm pleased, and therefore very pleased, to announce today that we are expanding our partnership to tackle Gavi's core work in supporting the critical routine immunization. To this end, we're designing a new front-loading facility to accelerate up to 1 billion euros of sovereign donor commitments to catalyze Gavi's core efforts in the next strategic period, while remaining nimble for the next pandemic by enabling access to funds from contingent grants. This mechanism is designed to specifically address the challenges ahead. We're ready to leverage financial innovation to address pressing issues of the intersection of climate and health, pandemic preparedness and response, and well beyond, in service for Gavi's incredible mission. Let me close by thanking Dr. Berkeley and the team at Gavi for their amazing work and for ensuring that no one is left behind in the pursuit of a healthier world tomorrow.
Thank you very much for your intervention. Let's keep it moving. Let's keep the energy up. Ms. Carter, perhaps I'll start with you. What challenges does climate change pose to CSO partners, and what can we learn, and how can we collaborate with climate-focused CSOs in particular?
Well, first, I just want to say, really thrilled to be here with these national and regional and global leaders. And I was actually asked to respond a bit because of the work we've done more around the pandemic piece of this. So if I can kind of respond a bit to that piece. You know, in the context of pandemic preparedness and response, and I think this is also relevant for the impacts of climate change, I think we too often, as a global community, that we've slipped into this false choice between preparing for the pandemics of the future and tackling some of the biggest health challenges of today. But it's the same strong, equitable primary health systems with sufficient and supported community health workforce that are needed for both. And I feel like we've heard that strongly from ministers over the last few days, and we really need to listen. And you know, Gavi's work to support countries on immunization is such a powerful example, right? It shows how we strengthen our future capacity by strengthening the primary health delivery systems that save lives and improve them now. And in so many cases, it was the same cold chains, the warehouses, the health workers, the infrastructure that was able, you know, for routine immunization, that was able to deliver around COVID at a massively increased scale. And it also feels that the work of expanding immunization systems and reaching zero-dose kids is really about expanding the healthcare delivery system to everyone. And that is at the core of what we need for real country-driven pandemic preparedness and response. And so rather than building kind of dormant, siloed surveillance systems, when you build the community systems that reach people now, you're also prepped for the future, right? You strengthen the delivery and also the community surveillance. Because how can you have an effective surveillance system if so many people aren't being reached by the health system in the first place, right? And I think that actually the tracking and reaching the zero-dose kids is incredibly important on its own, but is also one of the best proxies we have for the health system and if it is really serving and reaching everyone. And I'll just end by saying we also saw over and over again in COVID that when there weren't guardrails to ensure equity, just mounting a global response wasn't enough. You know, countries jumping the queue, export bans. The theoretical global readiness falls apart when it isn't equitable and it isn't supported at the local level. So I just want to say I'm really encouraged by the work on an AMC for Africa vaccine manufacturing to actively support the leadership and the capacity in this critical area, but also to be a protection against disruptions in the global supply chain and against some of the vaccine nationalism that we frankly saw during COVID. So just to end, we need to recommit to the core community and country capacity that's at the heart of real preparedness. And we need to make sure that the current conversations about pandemic preparedness in UHC really center immunizations and key pieces of primary health care because they really are the keys to success and to resilience. So thanks.
Thank you very much. Farid, we've been hearing about the challenges that countries are facing, including the expected increase in pandemics. You're in charge of health and education investments at IFC. Can you tell us about some of the investments IFC is making to support pandemic preparedness and climate adaptation?
First of all, I'd like to thank Gavi to have us here, being able to share our own experience. But before I go there, I want to also recall and emphasize the fact that the World Bank has been a founding partner of Gavi, and we've been on this journey since the beginning, since inception. I would say we've gone and we've learned along the way. Since 2016, we've actually kind of increase the technical assistance within the World Bank with Gavi's support under the partner engagement framework, and this is something that is working very strongly. We're country-driven as well, just like Gavi, so we align very well in this regard. Over the last 6-7 years, we've kind of also pooled our financing for health system strengthening under projects and country-driven projects. Within what IFC does, and IFC is the private sector arm of the World Bank, and with Gavi together, we've been thinking about both the demand side and how we strengthen the system, but we've been thinking and supporting the supply side. How do we make sure, and I think we've heard it yesterday from ministries of health, we've heard it from Jean today, localization of capacity and capabilities is a key theme. And it's a key theme to ensure resilience, self-reliance. And I think whether it's a pandemic induced by an outbreak like the one we've known under COVID, or a one that will be induced by climate change, and it's really something that is ahead of us, we need to be prepared. You know, the one key learning, and I was in Africa, in South Africa, in your country, during COVID, the whole of COVID. And there is one thing that we realize very clearly. Low and medium income countries, especially Africa, were far way too dependent for externally, for produced medical supplies and vaccines. And this is something that naturally the IFC, we want, and the World Bank Group, we definitely are committed to change. If the continent of Africa, 1.2 billion, to be 2.4 in 2015, still imports 99% of its vaccines, 80% of its drugs. This is simply something that is not sustainable. And when we think about, climate-driven health burden to come, without, local supply and local capabilities, we're going to have an even bigger problem. So we're investing into first identifying who could be the reliable credible, strong manufacturers to be and local producers of vaccines and drugs. And the goal is really to build a healthcare self-reliance, self-sufficiency, and a kind of end-to-end type. So we're not just looking at the manufacturing of drugs or vaccines, but also the ecosystem, the supply chain, and the production of substance and components that are critical for that. And as an example, the IFC is involved, just like the European Investment Bank, my friend Nafisa from USDFC, in supporting the likes of BioVac, and we'll heard from Farah here, and Dr. Morena behind me, but also the Institut Pasteur in Dakar. We've supported Aspen in the midst of the pandemic, and we're looking at really growing these capabilities, supporting them with innovative financing. So anything that goes from growth capital to help them grow, could be equity, could be debt, but also advisory and technical advisory services that we provide in-house. We were talking with Bharat, that is now a global player in India and globally. We partnered with Bharat when they were only 4 or 5 years old. And now they're a global player. So there is merit in putting growth capital into the right place to get to self-reliance and health sustainability. The last point I would make, because I couldn't agree more with you, Ms. Carter, primary care is critical. We've seen the second learning was really the last mile. And without a strong primary care delivery, and we do invest a lot traditionally in IFC, we've got a portfolio of $5 billion, a lot is health services. We still need to crack the code on primary care, and we're working on public and private partnership in this regard, and also leveraging the health tech solution. This is what's going to help us augment capacity and capabilities on the ground. So I'll just pause here.
Thank you very much. Farah, let's pick up on what Farid says. He was speaking about how he lived in South Africa, where you're based, and the challenges on the African continent when it comes to vaccine manufacturing in particular. We're also seeing a mobilization of support of the expansion of the sector in Africa. Just what you have to say to those in the room about the need for support of the sector, and how can we build a substantial and sustainable footprint?
Thanks so much. I also just want to take this opportunity to thank the Gavi team. As an African manufacturer, we really appreciate this opportunity. I also want to ask Farid if he stole my presentation. No, I'll leave that for now. So I think, we're certainly seeing mobilization across the sector. Two notable ones that I'd like to call out is just the Gavi AMC design. The depth and the construct of it has been so fantastic to see. And we also, as an industry, appreciate the opportunity to give input and the feedback that they keep seeking. So that's the one. The second is just the urgency with which our new Africa CDC Director General, Dr. Kasey, and his team have gone about just the procurement reset that's required on the continent. So these are two I'd like to call out. But at the end of the day, your question is about sustainability, and everybody is interested in how can African vaccine manufacturing be sustainable. And I think ultimately, as we all know, I'm going to repeat it, it's linked to demand certainty, volumes. Volumes give you economies of scale, which ultimately reduce the time to cost competitiveness. But it's not that simple. So 3 things I'd call out amidst a very chaotic landscape. I'm just going to talk to 3. The first is partnerships, right? I think we need technology transfer partnerships, which I'm hoping the AMC can signal to multinationals and global folk that it's sustainable to come and invest with an African vaccine manufacturer. We need partnerships with development companies, with funders. So partnerships key, right? And enabling ecosystem, key. I think in terms of skills, in terms of a regulatory reform. As an African vaccine manufacturer, you need a WHO PQ to even get access to the market. So enabling ecosystem, but these we know through Africa CDC's initiative PAVM, those are focus areas. So the third one that I want to use my last minute to talk about is just the strategic funding and support approach that I think is needed really needs to be focused on nurturing and supporting and leveraging existing infrastructure and capabilities, whilst at the same time, looking to fill the gaps on an antigen or platform-specific basis. Now, let me give you an example. A company such as Biovac, now I'm going to speak about Biovac, right? A company such as Biovac has built formulation fill finish capabilities across 3 antigens with 2 multinational partners, Sanofi and Pfizer, and it's taken more than a decade. But with each technology transfer, it's faster. With each one, we are building capabilities that make it easier for the next one. We have done development. We've got a team of scientists sitting there doing development, which we've even out-licensed across the border. We are now, speaking of climate change, embarking on an end-to-end journey for cholera, which how more relevant can this be, right? And this is in partnership with IVI and BMJF. You've got our good friends Aspen down the road who've got existing capabilities, lots of infrastructure invested in. You've got IPD who've got a PQ'd yellow fever. And if you're looking at new antigens, you've got Afrigen, the mRNA hub, right? These are existing capabilities. They've taken decades to build. And I think it's critical that we support these projects and look after them and nurture them, because this is ultimately the key to the fastest journey to achieve the 60% from the continent for the continent by 2040. So I think, this is the only way we also build capacities and capabilities for pandemic preparedness. So in conclusion, when the team approached me with this topic, I thought back to an article I read. Peter Sands from the Global Fund said that the next pandemic could already be among us, and climate change means no country is safe. So unfortunately, we can't be sure that the protectionism and vaccine nationalism that we saw during the pandemic won't be repeated. So when we talk about accelerating the journey of African vaccine manufacturers to sustainability, about the Africa vaccine self-sufficiency, I want to please ask that we remember that we're not just talking about continental health security, but of global health equity. Thank you so much.
Thank you very much. So Sepi has quite a unique perspective on how vaccine innovation can be part of a multi-sector approach to preparing for a future pandemic. Listening to the discussions and what's come out today, what do you see as the very urgent priorities to tackle the rising risk of another pandemic being brought on due to climate change?
Thank you. And firstly, thank you to Gavi, but also thank you to everybody in this room, because you are the extended alliance that has made all of this happen. And the stories from the stage today just remind us how important that is. So thank you first for that. I'll repeat a couple of messages, but they're the right messages and they bear repeating. I mean, one is that climate and environmental encroachment will change health needs, routine health needs, but also increase our risk of outbreak and pandemic risk, whether that's by population movements or whether it's vector changes or whether it's zoonotic spillover. So we know this risk will come. We need strong primary health and routine immunisation systems that can adapt to these new changes, not just today, but next 5 years and 10 years health needs, and also be the basis for those emergency responses. And we've just heard that from our colleague from Results. So it's crucial. There is only one health system, and this is the health system we need to engage in. So in that respect, both the country and the Gavi investments that are needed to vaccinate the next billion are also the investments that start helping us prevent or stop the next pandemic. So these things do go together. We've heard a lot about what we need from resilient communities, resilient systems, but we are also going to need the right vaccines and other medical countermeasures to add into that, to give us the tools to respond. Now, we can only do that quickly when we need to, if we invest in preparedness and respectful partnerships, to use the African CDC phrase, respectful partnerships now. And now for CEPI, that means not just manufacturing and other things, but it means the R&D partnerships. And for us, that means investment in preparatory R&D, including vaccine libraries, including getting ahead of where we know the next threats will come on. We know what the main viral families are and where we can get ahead with that in prototype vaccines or looking at the enabling sciences that will allow us to go fast. We need partnerships for clinical trial and laboratory capacity in the countries in which those diseases will happen. So we need to work in partnerships in Africa, in Asia, in Latin America, and we're beginning to do that and looking at how we support what is there already to network more effectively. We don't have to reinvent everything, but we have to be able to be more agile and connect more effectively. We need, and we've talked about the diversified manufacturing capacity, and it's fantastic actually that Gavi is beginning to think about how to make that sustainable, that we're working with Africa CDC on PAVM, that we have partnerships already for CEPI with IPD and Aspen, and we will announce new partnerships soon in Latin America and in Asia. So those need to be viable, and they need to be able to switch to pandemic and outbreak products when they need to. We've got the technologies that will allow us to do that now. And then crucially, of course, we need the money, and thank you to the EIB for it's good to have a €1 billion announcement from the stage. We need the money, but we also need the operational end-to-end partnerships to work. So the R&D and the manufacturing piece is important, but how do we pass the baton to the regional organizations, to Gavi, to the country ministries of health, so that we can actually see products get to the people who need them? And that means working on the operational difficult things. Who takes what risks? Who has what role? How do we do the handoffs? How do we think about the financing? What are the triggers? And we can work that out before, because last time with COVID, we did an amazing job, but we did have to fly the plane and as we built it. So let's try to save us from that time next time. So that's why CEPI is working with Gavi and WHO and UNICEF and PAHO and Africa CDC and our country partners to do that preparation. And if I can change sort of an African proverb, there's, if you want to go fast, go alone. If you want to go far, go together. Well, if we prepare well enough, we can go fast and far together, and that's really what we need to do.
Powerful. Thank you so much. It's a good remix. It's a very good remix. Mr. Guangsheng, you're a provider of cold chain solutions. Can you explain how countries can reduce their carbon emissions, improve resilience, and reduce costs through the solar electrification of primary health facilities in particular?
Thank you. Firstly, please allow me to express my gratitude to Gavi for inviting us to share in this conference. Anyway, I think for new energy is very important for the carbon emission. And so, as renewable, clean, and renewable energy for solar is very important. And it will play an important role in the remote healthcare system. And for areas without electricity or something with electricity, for solar energy will do help for the reduce the carbon emission. And this multiple classic study for us is for solar direct drive refrigerator, cold room, and some technology products. What perfectly meets the needs of cold chain for vaccine in areas without electricity. Okay. Moreover, by using this solar energy, each equipment can reduce carbon emission by about 380 kilograms in the 10-year life. For Gavi, as an important leader of global immunization, had been promoting the world's largest CTOP since 2015. Using solar radiation, it reduces the carbon emission by 7,000 tons per year, which is a theoretical number. As a manufacturer, we are achieving the carbon efficiency target in different directions. By solarizing our factory, we achieve 860 tons carbon reduction. And by facility upgrading, we achieved about 150 tons carbon reduction in 2022. Besides, biotechnology development we have 43 models get the Energy Star certification. I think if any company, any manufacturer pay attention to ESG and to explore innovative ways to reduce carbon emission, that will be good for the future, to reduce to change the ways for climate change. And for Herbal Medical, we should do this together with you all. Thank you.
Thank you very much.
Thank you.
Now we have time for some questions. I'm going to ask that you please raise your hand, introduce yourself, and have a short question or comment. Please can we bear in mind that we've got so much content to still get through. We're really excited about being here, but we also do want to keep it moving. Please maybe raise your hand if you have a question. I don't know if you're scratching your head or you're raising your hand for a mic. I'm just waving. Okay. All right, let's continue the program. I know that we are going to be here even after this panel ends, and so we can interact outside. I'm going to now invite Dr. Berkeley to come to the stage. He's led Gavi through the pandemic and ensured that the Alliance played quite a seminal role in accelerating deployment of vaccines during the Ebola outbreaks of the last decade. Dr. Berkeley, you are no stranger to crisis, so we invite you to please share some reflections on the discussion we've just had.
So, first of all, I just want to say, wow. And, you might have come here and said, why do we have climate and planetary emergencies and all of this on the agenda at a vaccine conference? And the answer is, as a learning organization, as a partnership that has to adapt and adjust, we realize, as Tanya said, this is where the world's going and we have a role to play here. And so, we are going to do everything we can to move forward, and we're going to do it in the way we usually do it, which is in partnership. And so that's the reason I'm saying wow, is if we've just listened to the remarks of a very large panel, but the diversity of approaches that are being on this panel, all of which are linked together, which could be weaved together as a tapestry to make a difference for the countries that we work in and for the world. So I want to start off, first of all, to say that, we're talking about one piece of this. If we think about planetary health, it's the planetary biome, it's the oceans, it's the changes in land, it's the change in fresh water, all of these factors. We're not going to be able to change all of those, but we are supportive of the efforts across the world to make these a priority. But where can we make an effect? So first of all, as we're moving into 5.1 and now thinking about Gavi 6.0, we want to deal with the direct effects on climate change of the work we do. So you just heard from Haier, one of the largest manufacturers, the effects we can have on the cold chain. We've already done that, 44,000 new units that are solarized, and we're continuing to move that forward. Of course, one of the challenges we had in the past was our job is vaccines, narrowly focused, and one of the themes at this conference is how do we integrate, how do we think? So now we're expanding and asking the question, which we should have been able to move on a long time ago, is if we're going to put a solar refrigerator, a set of batteries, and solar panels on the top of a health center, why aren't we just electrifying the whole health center? And how do we form partnerships to do that? Because again, this is going to help in climate change. So that is happening now. Looking at our CO2 emissions, we've talked about the travel-related issues, moving vaccines forward. We've talked about the waste-related issues. These are all important on direct effects to try to reduce the footprint of healthcare we heard about earlier today. But of course, the other thing we really have to worry about is the mitigation of what's happening across the world. And, some of the numbers, by 2050, it's estimated that there'll be an increase of 25% in yellow fever cases because of the spread of the vector for this. By 2100, 2.25 billion more at risk for dengue, chikungunya, and malaria. So we have to be prepared and help countries prepare for this. We've heard a lot now about working in the area of PPR. You heard this morning some of the lessons learned from COVAX. How do we make sure we have the surge capacity, we have zero-day financing? How do we deal with risk? These are critical issues that we're going to have to work with. And we also are going to have to shift from not just doing outbreaks, but how do we do prevention for outbreaks better? And I showed you some examples on cholera, trying to go to cholera hotspots. We've heard about increasing production of cholera vaccine. And, my brother, Jean, who is forming a really strong bond with Gavi on how we together will make sure that countries are prepared going forward and move from not only prevention in general terms, but prevention of outbreaks that, that haven't occurred yet. So I think these are really important things that we can be doing going forward and will make a difference. And lastly, we've talked a lot about regional manufacturing and the importance of that, trying to create global health security in regions of the world that don't currently have facilities. So it is true, we have a good ecosystem and we can get vaccines everywhere in the world, but when stressed with vaccine nationalism, we saw it break down. So how do we work together to create sustainable, high-quality production? The sustainable word is the critical word, because we can all be enthusiastic and say, let's create facilities. Of course, we can do that. A lot of work is underway to do that, but the real secret is going to be in peacetime. We don't know when the next big pandemics are going to occur. How do we make sure those facilities can have the staff, can have the supply, the equipment, everything set up and can keep working during peacetime, so when the next inevitable pandemic does occur, they're ready to flip over and be able to join the world in dealing with that. The last thing I'd want to say is we've heard a little bit about this, the One Health idea. A lot of work has to be done to turn from what is rhetoric into practicality, but this is going to be a really important issue because, of course, animal health is going to be critical to this, and we're really seeing some interesting effects. And an example on the vaccine side is if you're thinking about, mares, are we vaccinating people or are we vaccinating camels? The more and more we have to have those questions. As we roll out a rabies vaccine, you can't do it without having dog vaccine. So we have to be thinking about a One Health approach for all of this. And these are all factors that we, the Alliance, will have to think about in Gavi 6.0. So I just want to, again, where I started, wow on this panel and the amazing partnerships that are here. And thank you all for the incredible work we're all doing together to try to deal with this very, very difficult issue.
Thank you very much. I think it's all been said. I had a little blurb written, but I think Dr. Berkeley has really covered us so nicely. I would just like to say thank you so much to our participants. You've really added so much for us to think about. It's now time for just a video wrap-up of what's happened over the last few days. We're going to have a very short 10-minute break. The session that's coming after 10 minutes, I highly recommend it. It's going to be phenomenal. Maria Ramos is going to be chairing it. I'd advise you to please take a 10-minute break. Please come back into the room. It's really, really going to be good and unmissable. Thank you so much.